suffering from this particular virus. And we have certainly experienced all of that over the last 2 years and continue to experience that today around this. We continue to see a high volume of patients that are presenting into our healthcare delivery system with COVID-19 disease. We have 70 patients in the medical center this morning that are COVID-19 disease positive from this. Only 10 of those that are in the ICU today around that, but still a number of folks that need medical care and that are requiring hospitalization through this. This is at a time where we have seen a continued attrition of healthcare workers, those that are being able to deliver healthcare and work in healthcare since the start of this pandemic, 2 years ago from this. We are continuing to see short staffing, within the organizations, requiring us to, delay and defer surgeries that aren't urgent and emergent because we just don't have the staff, that's available to be able to care for these patients, post their procedure from that. We have seen a lot of improvements, again, over the last 2 years. We have now, vaccines, which are effective in preventing the severe hospitalizations and death. We've seen those over the last year. They are helpful to this. We also have monoclonal antibodies, even though they're on short supply, IV monoclonal antibodies that are effective to this, and starting to see an increase in the amount of oral antiviral medications that are available to our patients. As we continue to experience this, we want to continue to encourage folks. If you have not been vaccinated, it is still not too late to get vaccinated against COVID-19 disease. If you've received, the 2 vaccines or the 1 vaccine of the Johnson & Johnson, it's not too late to receive the booster vaccine as well, as we know that gives us added protection against this severe hospitalization and death, and will decrease the strain on the overall healthcare system from that. With that concludes my opening comments here this morning, and I am happy to take questions. We'll start with Nicole. Nicole?
Hi, Dr. White. Thanks for doing this. You kind of talked about what I was going to ask right off the top, reflecting on the past 2 years. So what about looking forward? Where do we go from here?
I certainly think, as we look forward, we need to continue to do the things that we need to do to protect our folks, continue to encourage vaccines, continue to consider wearing masks when we're in non-well-ventilated places and indoors at times when we know that respiratory viruses are easily spread in the winter months and the times that we spend times inside. We need to continue to work to, rebuild and encourage folks to come back to healthcare, make our environment, able to care for patients, and then start to focus on preventative care and restorative care for those things that we've had to defer over the last 2 years to get people on the journey to health that they're looking for. We have a lot of work in front of us. Move on to Liliana.
Good morning. Thank you. Going back to 2 years ago and reflecting on that moment when that first case was announced, did you expect for this to prolong for 2 years? Was this something that medical professionals thought it might be under control in a matter of months? Reflecting on that, what would you say?
Again, when we first saw the first case and we saw what was happening over, outside of the United States and China around this, we knew that we would see this within the United States. I don't think any of us would have predicted that we would still be dealing with it to the magnitude that we're dealing with it 2 years, past that initial case. This has been, eye-opening to us all. I think it demonstrates the work that we are going to have to do as we rebuild this to be prepared in case this were to ever happen to us again, that we have better systems in place to quickly, respond to this, be able to have, better strategies to be able to manage through this. Stephanie?
Oh, hi, Dr. White. Yes, you kind of mentioned this about delayed procedures. How is the rest of the health system at Valleywise being affected right now by this staffing shortage and obviously high number of patients in your hospital?
Yeah, our consensus continues to be high, not only with COVID-19 disease positive patients, but just with our normal routine patients that seek healthcare for other concerns that aren't COVID-19 related around that. With this, we have to continue to care for all of those that present into our emergency departments, present to clinic with those urgent and emergent needs that need immediately attention. So that puts stress, on the entire system. And we have to then decide, make choices around this as how are we going to best serve all of these needs of all of these people that need to have these things done around that. So our team has done a remarkable job over the last 2 years, being able to care for all of these patients, make sure we're able to meet everyone's needs as best as we can in these trying times.
Are you delaying or canceling elective surgeries at this point?
Yes, we continue to have to prioritize surgeries at this particular point. Those surgeries that can be safely, deferred for 30 days. At this point, our surgical teams prioritize those folks around that.
Thank you.
Nicole Garcia.
Hi, Dr. White. Thank you. Can you speak about kind of the morale among the staff? We did a story about a Valleywise nurse just, completely emotionally depleted after seeing her patients die every day. It's 2 years, and what's the morale in the staff, and what are your fears about burnout and losing people?
Excellent question. I'll tell you, our staff is just tremendous. They are dedicated to the care of our patients and providing that exceptional care every day and every time they come to work. But this work is tiring. Folks are becoming tired, and I think you recognized it, burned out, as we're seeing this day over day over day. But many folks that choose to work in healthcare, this is a calling. This is what they've chosen to do, to be able to give back and make sure that we're able to treat people, to help them meet their goals of how they want to proceed in life and be able to treat them. But this is wearing on everyone around this. And folks need to be able to take time to recharge. I'm amazed at the resiliency of our team, and I cannot speak highly enough of them, but it has caused a toll. We've seen people that have left healthcare that need a break from being able to do this work, because it is hard work, it is trying, and can be emotionally taxing to do this. And that's why, again, we're hopeful that we can be able to do those things to help us mitigate the spread of this. Wearing that mask when you're indoors in those crowded environments. Certainly consider vaccines if you haven't been vaccinated to this particular point, and help us decrease the burden on our healthcare systems. Colton?
Colton, do you have a question?
Sorry, didn't realize I was on mute. At the last update, you guys said that the hospital had requested paramedics and military personnel from the state to come help with staffing. Have you guys heard back, and will you be receiving the extra help?
We have not heard back. That request is still in and is still pending, with the state and with the federal government. Back to Nicole Garcia.
Following up on that, can you talk about monoclonal antibodies? The FDA now only approving the one that works. So, and I know we got federal help and money specifically for antibody treatment. So what's the status on that? And what's the status on the amount of antibodies, I guess, that Valleywise Health has available for patients, the Citrobactam,
I do. No problem at all. So Citrobactam, we know, is the only of the IV infusions, that and Evishield are the two monoclonal antibodies that have been demonstrated to be effective against this current Omicron variant of COVID-19 disease. Valleywise Health has only been using Citrobactam, since the last week of December. Once Omicron became the dominant variant, we had switched all of the monoclonal antibody administration that we were doing within the organization to Citrobactam because of that particular fact. It continues to be very constrained. We have very limited amounts. I had 5 doses of Citrobactam that started the day this morning, available to be administered today. Now, it's a supply issue we order and get allocation, from the state, from the federal government. And as soon as it comes in, we have, continue to prioritize those patients, have lists of folks that are eligible from that to be able to call them, to have them come back to be able to get this medication. The oral antivirals are available for limited use within pharmacies within the Maricopa County here within the state of Arizona. Our primary care providers, emergency department providers will prescribe those and can pick those up at those retail pharmacies. Valleywise Health retail pharmacies do not have those medications. We have to, refer our patients to those pharmacies that have them here within Maricopa County. Stephanie?
Yes. Could you tell me what percentage of your patients are that are in the hospital are vaccinated versus unvaccinated?
This morning, I had 97% of the patients that were in the hospital were not fully vaccinated. And by fully vaccinated, I mean has had both doses of an mRNA vaccination and a booster, or the Johnson & Johnson plus a booster. Of those that had some vaccination, partially vaccinated, either 2 doses, 1 dose, or just 1 dose of the Johnson & Johnson, 76% of the patients in the hospital had not had anything at all. So there was that delta of 14% that had a partial vaccine.
And one more question: do you know when hospitalizations are going to peak?
I wish I had my crystal ball, Stephanie, to be able to predict that particular fact to do this. Usually as we've seen testing peak, hospitalization peak is usually come within the next week to 2 weeks past that testing hospital peak. We saw the testing hospital peak likely occur in Arizona at the end of last week. We've certainly seen case counts this week decrease week over week. So hopefully that's the testing peak that we are seeing of those testing positive. And the hospitalization peak, I suspect for us here at Valleywise, will either be the end of this week, certainly end of this week, or the first part of next week is kind of where I see this trending out.
Great, thank you.
You're welcome. Any final questions this morning?
Yeah, Dr. White, Steve Klossman with the Arizona News Radio Network. One just quick follow-up on something you said in your opening remarks. If I got it down correctly, you said you currently have 70 patients with COVID-related symptoms in the hospital. If I recall, when you've spoken before, it's been 40, 45, up to 50. Is this the highest number you've seen in this 2-year period?
This is not the highest number we've ever seen in this 2-year period, but this is the highest number we've seen within this current wave and this current peak with Omicron that we've seen. Our highest number of folks that were in the medical center peaked in January 21st of 2021, as I'm thinking about this, and we had 88 patients in the medical center at one point at that particular time. Any other final questions?
Dr. White, it's Nicole with Fox 10. TGen is saying that they have recorded the first, new Omicron variant in Arizona. What are your opinions? Should we be worried about this new Omicron variant or Omicron version?
We know that, phenomenal question. We know that viruses, and we've talked about this kind of in the past, we know that viruses mutate, that they change. We will likely see new variants of the COVID-19 disease, and COVID-19 virus, for a long time to come. How these variants behave, we just have to monitor. I saw that same note this morning, Nicole. We'll have to see how it goes over the next few weeks, whether it becomes dominant, whether we see any change to this at all. It's too early for us to predict anything at this point. Well, I just, again, want to continue to thank everyone, and I thank the community for their support and all of you all's support of healthcare, our healthcare workers that are truly, the face of this, providing bedside care for those that need it each and every day, that are exposed and having COVID-19 disease. Certainly continue to advocate. If you are feeling sick, stay home, talk to your healthcare professional about being tested. If you haven't been vaccinated, certainly consider being vaccinated, and please wear a mask if you're going to be outside in indoor, not well ventilated spaces with folks that you don't live with. So thank you all very much, and I hope you have a great day.
Thank you.
Thank you, Dr. White.
Thank you.